for everyone.
How often do you have low back pain?
Like a couple times a week. I think it has to do with my job and also being a mom. Following after like a year of having her, I would get sciatic nerve pain. I also have shoulder pain as well.
Is it when you work?
I think the pain that I experience now, not like my sciatica, I think my low back pain is probably because of my job.
Right.
Just because of me like running around all the time.
Tell me about your shoulder. How long have you had shoulder pain for?
A very long time, probably since I was in high school.
Yeah.
And it flares up a lot when I'm at work, and I think because with me bartending and I'm tapping beer and like the constant movement over and over again, but I'm not sure, but it gets really bad. Like sometimes my shoulder gets really inflamed that I am like crying. I do get headaches. Yeah,
Right.
And I only just started getting headaches. I was just talking about this in the last year and a half. Sometimes I get really bad migraines.
Do you do anything for it? Do you take anything?
No, I don't really like to take medicine.
Okay. Do you have light sensitivity?
I mean, if I'm driving, I guess, yeah, the sun bothers my eyes.
Do you get nauseous with it?
No, but when my head starts hurting, it makes me nauseous. You ever
Okay.
get that where you like stand up too fast and you're like about to black out?
Okay, how often does that happen?
Oh, a lot.
Have you ever been adjusted by a chiropractor? You went to a consultation. Have you ever been adjusted by one?
No.
Okay.
I went to the consultation and then I was under the impression that my insurance was going to cover it, and it did not.
Okay.
So then I was just like, I'll just deal with my back pain.
All right, good. So how do you feel about it? Getting adjusted today.
I'm excited.
Okay, very good.
Yes. I will say I am like a little scared for you to crack my neck. That freaks me out.
I will take my time. It's my job to make sure that you're ready to get adjusted, okay? So I won't, first of all, we'll practice adjustments before I do them so you can kind of feel what they're like. I'll let you know when I'm doing it. There won't be any surprises, and I'll make sure you're relaxed, so it'll be perfect.
Okay.
All right, looking at the feet first. I don't see any pronation or supination. Flattened arch on the right side. Good. Is it on the left too? Yep, both sides. And bowing of the Achilles tendon. That suggests some slight pronation at the foot. I don't see any inversion or external rotation though. Good. All right, from the knee down, nice and straight. No genu varum, no genu valgum. That's good. Hip swing looks symmetrical from the front. We'll see it on the back as well. High right shoulder. Okay, good. These are all normal stuff.
Okay.
Definitely a high right shoulder, possibly a high left hip if we look at the waistband. Yeah, you're a runner for sure. You could use some arch support. That's good. Put your hands on your hips, please. Okay, I'm going to place my hands on your hips, okay?
Okay.
Good. That relax. Good. Let your arms relax.
Oh.
Yeah. And definitely have a high right hip, high right shoulder, so we're definitely going to check for a curvature and a high right ear. So we're very this way. That would suggest an apex of curvature in the thoracic spine. See the bowing here on the Achilles tendon. Okay, very good. Just observing the spine. Let's check. That's definitely a high right shoulder from the scapula. And still a high right hip with the seated position. Actually, that did reverse. Now it's much more even, close to even, if not the left a little bit high. This is a temperature evaluation. I use the back of my hands, which are more sensitive to temperature. You have all the heat's coming from here. Shoulder blades. Maybe a little tad more on the right, but just as much heat coming off at the left. But it's really just to here. Starts to cool off. This is very consistent, calm, symmetrical. And then as soon as we get down to the sacrum on the right side again. Do you have any tenderness when I push here?
Not particularly, no.
Here.
No.
Lower SI here.
A little bit.
A little bit more. There's some swelling here. Do you feel all that bubbliness? Yeah. Right side, is this tender too?
Yeah.
More so here, just the most? 1, 2.
No, more on the left side.
More on the left. Okay, so lower SI joint, but tenderness on both sides. So we'll have to check for a sacral cup. Do you ever fall on your butt really hard?
I don't think so.
Okay. To the spine. Any tenderness, discomfort right here?
No.
How about here? Tension here? A little more?
Yeah, that feels weird, like...
In the front?
Yeah.
Okay.
That feels weird.
Good movement in the lower cervical spine there. Everything's fine. Upper cervical C2, not moving as much. Is that tender right there?
Oh, a little bit. Oh, yeah. Actually, ow. Yeah.
Looking at the pelvic tilt, you're going to feel my fingers on the back of your hamstrings, okay?
Okay.
Okay, we're going to trace up to the bottom of the glute fold. It's lower on the right. That means the right hip is going back like this or the left forward. Then looking from the top, feet are even. This looks pretty good. So no external or internal rotation, but we do have this right hip, left hip thing like twisted like that. All right, we just have a little bit of rib humping on the left here. Okay, just checking for very slight swaying motions in your posture.
That's normal, right?
Yeah, it's normal. It just depends on which way you go. But it's pretty steady. I don't see a whole lot of lateral. It's more front to back, which is good. It means you have a pelvic, that means you have a stable pelvic. Bend both your knees.
Like this?
Yep. It's pretty good, but you feel how the right one lags?
Yes.
Do you feel it over here in your hip? Okay,
Mm-hmm.
let's bring it down. It's coming from your coccyx. Ready? So I'm going to palpate your sacrum first. We'll start like this.
Okay.
This is your sacrum. I'm palpating down your sacrum. This is the end of your sacrum right here. This is your first coccyx segment. 1, 2. Tender?
A little bit, yeah.
1, 2, 3. Same 2 in the beginning.
Yeah.
It's tender, right?
Mm-hmm.
Okay, ready? But this isn't just coming from here. First of all, we have a lumbar segment out somewhere that I was pushing on before. That was at L4. It's on the left. Okay, first I'm going to correct this. This one still sucks, huh?
So tender, yeah.
All right, we have a thoracic segment then to deal with. Deep breath in. Good, and out. Good, shoulders sinking in. Good, letting it all go.
Oh.
How's that pressure, okay?
Yeah.
That one right there.
Yeah.
Okay, ready? Shoulders sinking, letting it all go. As you breathe out, just feel your whole body sinking into the table.
Oh. Oh. That felt so good.
Good, shoulders relaxing. Good, perfect. Just like that, let the shoulder go here. A little bit more. Your waistband so I could contact the SI joint, okay?
Okay.
So we're just gonna lower to the SI joint right here. Good, this one has gone posterior and inferior that way. So let's give it a try. Go ahead and take a deep breath in. Good, and out. Good, shoulders sinking. How's that, by the way?
That felt good.
Okay, nice and gentle. Okay, here's the acetabular ridge here. Good, go and take a deep breath in. A little bit more. Lay on your back. You all right?
Yeah.
Okay, go ahead and turn your head to the right. Back to center. Okay, now turn your head to the left. Back to center. Bring your right ear down to your shoulder.
Like this?
Yeah, center. Bring your left ear down. Not much going on, lower circle. Just like the other adjustments, I'm going to bring your head over to the side like this. Good. And all you have to do is breathe and let go, let your head completely drop. I'm going to follow your breath in this direction, and we're going to push like that, okay?
Okay. That was crazy.
Pretty good, right, though? No pain.
That was so crunchy. No pain.
All right, nice and gentle, sinking in here. Good. We're going to adjust very gently at the top. Let the head drop down this way. Good.
That was crazy.
Okay, I'm going to adjust your ankle now. I pull down in this direction like that, okay? We're done with this go. Good. Just sinking in. It's right there. All right, I'm going to adjust your pubic bone, so you're going to squeeze my fist in between your knees. Go and squeeze. Hard as you can. Did you feel that?
Yeah.
It's your pubic bone. Okay, I'm going to do a digestive organ manipulation. Okay, we start with the ileocecal valve. Okay, this is the window between the large and small intestine. We find it by finding the belly button and the ASIS. We connect these 2 points.
Are you gonna make me fart? Yeah. Yes.
Okay, nice slow breathing. Pyloric sphincter is where the stomach empties into the intestine. Yours is here. It's empty. It's good. Okay, now I'm going to do a diaphragm manipulation. Okay, nice and tender right there, huh?
Yeah.
Breathe into your belly. Do a belly breath. Now do a belly breath. Good, and out. Good, do it again. Belly breath. Out. There it was. Better? Now it's tender, right?
Yeah.
We're going to go like this, and then at the end we pull like that.
Okay.
Okay, I do this all the time. Don't worry, it's going to be great. Shoulders and hips and everything is letting go. Letting go. Brent.
That felt crazy. Oh my god.
It's okay for it to be a little stiff.
That felt crazy.
Keep breathing.
That felt so good, but that felt really weird also.
It's pretty crazy, right?
Yeah. Yeah, I don't really think I can compare that to anything else.
Did you feel it all the way down?
Yeah.
You're going to feel great.
Oh yeah.
I think your headaches, I think there's a good chance that a lot of your headaches are actually coming from a lot of this like neck shoulder stuff, even though you may not feel that all the time. But if they're tension related headaches, then you should probably feel really good after this for a while.
After that, my body feels really crazy. That was crazy.
How's your back feel?
It feels really good. It doesn't hurt, so that's good. I feel like, I don't know, that really like, that felt really weird. But I feel good. Like, I don't feel like any pressure, like tension or anything.
Yeah, good. Right after this here was deep breath. Okay, ready? How does this feel like compared to this? Are they the same? In one direction more tender than the other? 1, 2. Which one hurts? 1, 2. Or the same?
They're about the same. I feel like, no, my left side a little bit.
This is tender, right?
Yeah, a little bit.
Open your jaw.
Ow.
Sorry. Close. Open. Close. Open. Almost. Okay. Breathe, 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 breathe. That was good.